What's up, guys, and welcome back to the Paper Jacket Podcast. In today's episode, we have Dr. Labrada from Orange City Modern Dentistry over here in West Volusia County. Dr. Labrada's dentistry is a family dentistry that offers PPO plans, memberships, and many other things, and he is here to talk all about it and how he ultimately got started with his own private dentistry. Hope you enjoy. Hey, Dr. Labrada, thanks for joining our podcast today.
Thank you for having me.
So you are a dentist in West Volusia County, Orange City specifically. Why don't you talk about that?
Yes. So we've been here in Orange City for 6 years. Mm-hmm. I purchased the practice from Dr. 𝗚𝗵𝗄 Rodriguez, who was retiring in December 2019.
Gotcha.
And we've been there since, growing.
When did you, was that your first dentistry that you started or?
First private practice, yes.
First private. So you were working with another dentist?
Yes.
Okay.
Yes. So I'm originally from Cuba. I did my dental school in Cuba a while ago. Let's not get into that. And then after I came to the States, I had to go through the process of taking the boards and getting the license here. So I went to UF and got an advanced general dentistry studies 2 years program to get the Florida license. And that's how I started practicing dentistry here.
Yeah. And what made you ultimately say, I want to start my own private practice?
So I have worked in the dental field for a while, and I have tried corporate dentistry, private practices, small groups. And after seeing how everybody worked, I kind of had my mindset of what I wanted to do and what I think it was, the best for the community, for my patients, for the way I like to do dentistry. Yeah. So once I get my license, I knew that I wanted to have my own place, basically.
What would you say was the major thing that you wanted to bring to your dentistry that was maybe different from others?
I want dentistry to be personalized and to not treat a number or not treat a tooth, but treat a person. Sometimes it's in nowadays world, it gets a little bit of challenge.
I feel like in many ways, someone finds a dentist simply, what takes my insurance? Like that's kind of like the first thing, or just friend, where do you go, or something like that. It's sort of I have found like difficult sometimes to like shop around for a dentist because you have to ultimately try them out, go through the x-rays, go through the appointments, stuff like that to ultimately try them out. And so when it comes to your dentistry, are you usually one who your patients come to you because insurance is offered? Do you offer insurance?
Yes, we take most of what they call PPO plans and a lot of Medicare plans for the senior community. One of the things that I like from my practice is that we treat our patients and our staff like a family. See, I like to stay in the community. It's a very different perspective when you're a dentist on a private practice on a small community, because you're going to be seeing families and patients for a long term. Yeah. So I've had patients that, started coming to the practice when they were 6, 7. Now they're in their teens, and then they're bringing their cousins, the older brothers, or mom and dad, and then grandpa. That's, basically how we like to be known for, to be a family dentist that will be there for many years.
So you are actually, make sure I'm saying this correctly, pediatric dentistry? No. Okay.
No.
So while
It's
you've
a
seen
general
6 and
dentist.
7s.
Yes, I do see kids.
Yeah.
We have kids,
Yeah.
but it's a family dentistry. It's a general dentistry.
Right.
We do a little bit of everything.
Yeah.
There are some cases of kids that needs a pediatric dentist because of the complexity of their case, and then we'll refer them out.
Right.
But basically, for basic general dentistry, we see patients of all ages.
What's something that you saw maybe another dentist doing that you worked for, or just maybe know of, that you were like, this is what I want to do differently? Or maybe a way that you saw how they treated him more like a number than a family member kind of thing?
Well, I had, through the years, I've worked for other dentists that are being mentors. I worked for an orthodontist in town, Dr. Preventive 𝗵𝗻. He taught me a lot about orthodontics and treating kids and teenagers. So I learned a lot from him, and I wanted to kind of follow that path.
Gotcha. So you saw a really good example.
Yes, absolutely. On the other side, I work for corporate dentists where the turnover of dentists and staff and patients was, a lot. I didn't want to do that.
Help me kind of know the difference truly between a corporate dentist and and maybe a private dentist like yourself.
Basically, a corporate dentistry or a corporate dental office is a corporate structure. They have several offices. Yes, it's like in a franchise.
Okay.
They have many offices.
Yeah.
They hire dentists, and some of the dentists stays there for a long time. Some won't. And some of those offices are great.
Sure.
Some are not that great.
Yeah.
Because of the same turnover.
Right.
And unfortunately, sometimes patients get looked at as a number. There's no follow up. There is no continuation or consistency, I would say,
Sure.
on their treatment.
Right.
So it's a whole different way of doing dentistry.
So what made you ultimately want to settle in Orange City? Was it because you were already kind of connected here with the community, or was this kind of a new community that you
It was a new community.
Nice.
I was looking for an office, and it happens that the previous dentist was selling the office. I came here and looked at it, and it was a great office, great community. She had a lot of patients for years.
Yeah.
And so we decided that, yes, we were going to move forward and get the practice. I was traveling to Orlando for the first 2 years because usually I live in Orlando before until I moved to 𝗵𝗵𝗃.
Yeah.
Yeah.
And so what do you think about your Orange City 𝗵𝗵𝗃 community, the West Volusia area?
It's a community that it's in development. It's growing a lot.
Yeah.
There's a lot of potential here. I had no idea before that I was gonna, practice here.
Yeah.
Because I lived over 12 years in Orlando. But I like it here.
Yeah.
I like my patients. I like what I do. I think we have created a good environment, not only for the patients, but for our team.
Yeah.
And that's important to me.
What would you say is a common thing as a dentist that you're seeing patients maybe ignoring until they come into your office, or things that you almost wish that the people would consider before coming to see you as a dentist?
So one of the things that has not changed for years, but a lot of people come to us as an emergency with pain, right? And fortunately, we are able to help them, and then they'll stay over. But that's something that I think we need to work on educating the community, the population, to have regular dental work, regular dental visits to avoid emergencies. Because
Right.
nobody wants to have a toothache.
Right.
But unfortunately, we remember about the dentist when our tooth hurts.
Yeah.
And then we're like, okay, gotta go to the dentist, or my gums are bleeding. Let me go to the dentist. So work on preventative and that consistency. It's very important to not have a toothache or bleeding gums.
Yeah. Yeah.
Because prevention it's more important and cheaper
Yeah.
than treating diseases. So
Naturally. Now, you are a dentist who takes PPO plans, as you
Yes.
said. And, some dentists don't offer or insurance. They want it to be a cash plan. Do you guys also have a cash plan that you provide?
we do. We have a membership plan for uninsured patients that we offer. So it's basically they pay one fee annually, and then they have benefit like exams, X-rays. Preventative is basically covered by that,
Right.
and then discounts on treatments and other stuff.
That's kind of the cheaper thing you're talking about. Is like,
Yes.
hey, just get the preventative plan, and you're probably not having to come see me for an emergency.
Exactly.
Yeah.
Yes.
It sounds like to me that ultimately what you are looking for is that family that just had the kid who just moved to this area, or who just maybe got a new job and are able to get dentist insurance or a PPO plan or something like that. Or ultimately they're not satisfied with their current dentist and they're looking for someone who's going to know them a little bit longer and someone they can kind of grow with and not be surprised with. I know that an experience that I had with dentists is that every year my wife's insurance plan would change ultimately, right? Something in there would change. And almost every year I had to look for a new dentist to kind of help me. And I was like, I'm tired of seeing a brand new dentist every single time. And I also experienced times where it's like, I feel like I'm just a number. And did they even look at my teeth before they gave me like, this is everything you got to do? And it's hard to find that particular dentist. It's like, okay, no, this one knows me, worked with me for a while, and I'm going to feel the same way about my kids. And that's ultimately, it sounds like, well, that's the practice that you're looking to provide.
Yeah. You got it right. I see a lot of patients like that, right? Where plans change and they have to change the plan. Well, it's convenient for the patients to change the plan if they want to use the insurance. However, we should not let insurance dictate who do we go to, because it's our health. you know? It's that's why there is a lot of dentists that are offering membership plans,
Right.
and they don't have any restrictions on seeing whoever dentist you want to go.
Yeah.
They don't have waiting periods for certain treatments. They don't have to have like higher deductibles on all that. So I think it's a good way to keep giving the service to the people that you like and they like you.
Yeah. Yeah. Could you go ahead and share with our audience, like the name of your dentistry, of where they can find you, your website, and your phone number?
So our office name is Orange City Modern Dentistry. We're located at 1640 South Volusia Avenue here in Orange City, across the street from Checkers and the dollar store. Phone number is 386-775-4911.
Very good. Definitely think a lot of people in West Volusia should be checking you guys out, looking into your semi-new dentistry, only since 2019. And ultimately, you got PPO plan, that's good, but you guys have a membership as well.
Yes.
And a family dentist that ultimately wants to grow with your family. That's a powerful statement right there.
And being at a general dentist, we're able to offer a wide range of treatments,
Right.
From pediatric dentistry to cosmetic, to implants, to aligners, dentures. It's quite, a few
Pretty
procedures,
extensive, yeah.
pretty extensive procedures that we have.
And they should start with you. And if it goes into anything, like you said, you have referrals, you have those things set up. But starting at your dentistry is probably the great spot for you guys.
Now you were saying about something that makes us different from other practices in dentistry. Now it came to my mind. We're called modern dentistry for a reason. So we're using the latest technology out there. We do CBCT, which is 3D X-rays to determine, have a better diagnosis of the treatment of the patient. Sorry, better diagnosis on patients.
Yeah.
And we also we make our own crowns in the same day. So we use labs, but very, very few when we have extended cases. We offer aligners, which is a new way of doing orthodontics without braces.
Gotcha.
So those are some of the things that, it makes us different.
Right.
Another thing is that we are open on Fridays.
That's good.
A lot of dental office, they work Monday through Thursdays.
Yeah.
So we're able to offer, and Fridays is one of our busy days.
Yeah, more opportunities. I mean, I bet Friday's a busy day because that's often my issue, right?
Yep.
When I'm trying to schedule with my kids, Fridays are usually the best day for the kids. Well, thank you for joining our podcast today, Dr. Labrada.
No, thank you. Thank
I
you
want
for
to give a
having
little
me.
toast to you. All right.
Thank
Cheers.
You. Cheers.
All right. Happy dentistry.